You are all welcome to the premises of Ghana College of Physicians and Surgeons. Feel free and relax, okay? But before we begin our program, let us all be up, standing for a short prayer. We thank you for our forebears who had a vision to establish the Ghana College of Physicians and Surgeons. We thank you for our learning and our studies. We thank you for how far you have brought us. Today, we are celebrating 2 decades of our existence as an institution. And we have our sons here to look at what has been achieved over the years. We commit the program into your hands. We pray thee, be with us through the process. And at the end of it all, we shall give you glory and honor. This we ask through Jesus Christ our Lord. Amen. Please be seated.
Right, so my name is I am the vice rector of the college. Why is this so important? Why is it important to be reminded of the past? So you know where you came from. Yes. Something we can learn from. Alright. Good things that we continue doing. The ones that were not good, then we stop doing, right? So a museum captures history. So you see, it's not being said, but you will actually see it. So that's the beauty of the museum. History has been captured for you to see. Now, this is called the Museum of Medicine. Now, medicine covers a wide range. So anybody who is a doctor, even if I said, they call you a medical officer, isn't it? So medicine sort of covers everything. Now, to become a medical doctor in this country, you will do your senior high training, and then you join a medical school. The training is between 5 to 6 years now. It used to be 6 years, 6.5 years, some people be 7 years. But currently it's about 5 to 5.5 years. When you finish, right, you will do what we call house job or housemanship, where we train you to practice. So you will do it for about 2 years. Then when you finish that, then you decide, I want to become a pediatrician, I want to become a surgeon, I want to become a family physician. When you choose that, then you come to the college. Alright, so the college does postgraduate training. Your medical training is undergraduate training. So you finish your undergrad, you do your internship or house job, then you are ready for postgraduate training. So everything you see here is from that point on, where you have finished and you want to choose an area where you want to specialize. How many of you want to become doctors? They are not me. That's okay. The rest of you want to become engineers, and then pilots, scientists. How are you all fine? Alright, so but I'm proud to let you know that this morning I am another day. Another year 83. Another year 83. This man here is another year 84. So when you go in, we'll walk you through the history of this college. We'll tell you, you see pictures of where we started from 2003 all the way. This is our 20th anniversary, so it's been around for 20 years. So you see how we started, the people who started it, why we started, the things we did. You also see some of you see some, don't be scared, by human molds. Alright? We didn't chew your meat, okay? Don't be too scared. So we are the history and some of you become journalists. We are looking for trouble. Investigating journalists. We didn't kill anybody. So you find things like, you see some of the equipment that were used in the past. Some of them are not being used anymore. Very modern things are coming. But at least you have an idea of what it is like. For some of you who think you want to be doctors today, you change your mind. But some of you who don't want to be doctors today, you change your mind and say, no, I want to do this. So that experience is important. So enjoy our museum, it's a college of museum, and welcome to Ghana College of Physicians and Surgeons. Thank you.
Good. And I'm the Vice President Physicians of the College of Ghana College of Physicians. We have the surgeons, Division of Surgeons and Division of Physicians. So I'm the Vice President of the Division of Physicians. And also the Chair of the 20th Anniversary Planning Committee. But I also told you that this college is 20 years. Okay? That's the only national postgraduate college in Ghana. And why are we gathered here? As part of our 20th anniversary, we plan a lot of activities. It's a year-long activity. We've had public lectures, we have medical screening, we've had health walks, so many things. And this month we're having the museum exhibition. And Dr. Lawson has told you about the importance of history. So as you go in, you realize there's a lot about our history and different milestones from 2024 on to now. As well as our milestone as a college, as well as the evolution of medicine in Ghana. I mean, you start from seeing the fetish priestesses and all that, using the herbs and all that. So you see that and then to what is happening now. So it's quite interesting. I'm sure you will have an exciting time there. It's an opportunity for you. I know your school is science biased, but like we said, it's not everybody to know a doctor. But then it's important for all of us to learn. I did medicine, but I did history at school as well. I did history. So please just everything you learn is see as important. Apply yourself, ask questions. You'll be going in batches. Dr. Otaria will take you. Dr. Otaria is a member of the college. Yes, I will take you to ask questions. There'll be a time for you to also read some of the books. So make good use of this time. We are very excited to have you here. In fact, you are the first school. We are starting with the same time of the So make good use of the time, ask questions, and we look forward to having some of you become members and fellows of this college. Thank you very much. Thank you.
Yes, I
Thank you very much. So this is a bit about we're going to look at the photographic education, okay? That is more about our milestones. And our theme for this 20th anniversary is 2 decades of postgraduate medical training in Ghana. Okay? So 20 years of, that's what we do, postgraduate medical training. And our sub-theme is we are going through a journey down memory lane. 20 years of postgraduate medical training. So that is about how the college started in the mid-1990s. So you can see that it goes to 1990s, where the idea of a postgraduate medical college, promoting continuous professional, that is training, providing coordinating education research, and then contributing to policies, health policies for the country. So this is our motto. You can come and look at it. But it's important for you to know that the college officially was inaugurated on 9th November 2003. So we're going to start now from 2004. But there's this picture here that depicts a bit of the members of the Ghana Medical Association. This was as far as 1962. Some of you were not born. I was born in 1962. At least I know some of them. So these are the medical gurus there in the country. So that's our members. They were then they belong to the Gold Coast division of the British Medical Association. So now let's start from 2004, looking at these pictures. And in 2004, the theme for every year we have what we call annual general scientific meeting. Okay, so we started 2003, but our first EDSM was in 2004. So after 1 year, we had our first GSM.
If someone wasn't well, they would say you offended the boss, so come and do these rituals back with the boss. Sometimes you will do some verbal preparations that you get what. And one challenge with that was all the methods the traditional healer uses is known to himself. Every healer does his style of treatment. But with orthodox medicine, there is a scientific method that I'm sure integrated science, you learn that the scientific method has some steps you go to establish that this is how something works. A good plant with medicinal purposes. During COVID, some people were using it as treatment for COVID. That's not proven though. That's some good medicinal purpose. In Ghana, there's a traditional medicine council that oversees that. So let's continue.
All right, so 2014, improving emergency care in Ghana. That was our theme. And over here you can see some of our guests, honorary fellow, that's an honorary fellow, and some of our guests. And that's, who remembers who this is? Yes. Let's clap for him. Well done. He was the guest of Pana then, and that is our president of the college.
So over here, we have an old doctor's bag. You would just be a grade, you wouldn't see any doctor having this, but in the olden days, when you call for a doctor, he will come with this bag and all the tools he needs, and the medications and other things he needs to attend to you were contained in this bag. Besides this, it's a stethoscope. Who knows what we use a stethoscope for? Anyone? Just raise your hand. Yes, we use it to listen to the heartbeat, and not only that, but also to your breathing. So it's to assess the heart and the lungs. So that's the stethoscope. Then it's on a mercury sphygmomanometer. We use the sphygmomanometer to measure the blood pressure. And this is the mercury type. So we can move on. This is a ventilator. During the COVID time, we had those who had complications from the COVID needed to be on ventilatory support because at that point you have respiratory failure. Your body, your lungs, your breathing is no longer self-supportive. So you need this machine to help you breathe on your own. Otherwise, you are going to die from respiratory failure. So this is how ventilator looks like. It's quite limited. I mean, most of the intensive care units can find the ventilator. There's the old type. There are modern type that have more components. Are we okay?
The theme for 2015, mental health in Ghana, new approaches to it. So what you've noticed is that every year we choose a theme. Okay, it's more the topical issue at that time, during that year. So it's mental health in Ghana. So this is the governing council. These are dignitaries at our 2013 AGSM. Okay, good.
In science, one of the branches is anatomy, another branch is pathology. Does anyone know what anatomy means? So the study of not only the internal structures or the structures of the body, and mostly the normal structures of the body, how the body looks normally, the macroscopic look of the body parts. And what of pathology? When we say pathology, what does it mean? Anyone? So pathology is the study of diseased organs. When the organs are normal, that's anatomy. When they become disease, that's pathology. So we have some specimens here. They've been put in this chemical that preserves them. So all these are they are from people who are known, but they've been put in this chemical to preserve them. So here we have the liver. This a part of the liver. The liver is the largest internal organ of the body, and this liver has a disease condition called cirrhosis, which affects the liver function.
It's still a topic, that is what we chose for 2016. And you can see in here the dignitaries again at the ceremony. Let's see whether you can remember.
Call them Lady Holy Heart.
The leadership justice, Georgina Wood, she was the chief justice. Okay, so that's over there. And this was when, this is the CEO of MDS Lancet. It was at a time with our rector who passed on. And this was when he refurbished a building for our policy department. So that's a picture.
This is a cross section of the brain. This patient had stroke or something called cerebrovascular accident or intracranial hemorrhage. One of the blood vessels in the brain got ruptured, leading to bleeding. Your brain controls all that we are doing here, seeing, moving, and everything. So when a part of your brain suffers a bleed, when the blood vessel bleeds, the blood doesn't get to the part of the brain that was receiving the supply. So that part becomes deprived of the oxygen and it loses its function. That's why part of the body may now become weak. Here is the heart. The covering of the heart is called a pericardium. Peri means around. Cardium is the heart. This patient, the person had diseased pericardium. And that type was called fibrinous. This, we have two kidneys here. There's one, there's another one here. And these kidneys are abnormal. The patient has some cysts. You can see this rounded things. They are abnormal. They shouldn't be in the kidney. The kidney should be very well defined.
So this is the very first, and it happens to be a Ghana. And they put it there, born in Accra, first Ghanaian to receive a medical degree from Edinburgh University. And we're very proud of him. Right. So because we are telling the history of medicine as well, we thought that we will bring some of these because we need to celebrate them, don't we? Yes. And this is Williams, also a Jamaican, born in Jamaica, but she's begun studying medicine at Oxford. And how can you know about Kwashiorkor? She was the one who, yes, she was actually the one who published about Kwashiorkor. She joined the, was posted to people. She defined Kwashiorkor as a disease So that is why we really have it in our annals. So these are some of our pictures from our annual General Scientific Meeting. We have our Vice President, then our Vice President surgeons, we have our rector, and then we have our college president. Okay. So like I told you, we have a rector who's the head of the secretariat, and then we have our president and vice presidents who are then the heads of the fellows and members. So take your time and go when you're ready. So you can go through what I have spent time.
When there are several ways to get dead bodies medical. Some people don't damage the blood vessel compared to the shaft part. However, it depends on how they prepare. It's not like a fast food that all the time this part is food. But with time, they will all become like the other.
Get to know most of the things you've heard about. For example, we've heard this famous condition, that is a septal defect. But most of us have not really seen how it looks like. But with this experience, I'm getting to see how the heart looks like. And also getting to know most of our history. For example, the very first female doctor in Good Cause, that is Dr. Susan Ofori-Atta. It has brought about enlightenment in so many fields. It has been a beautiful time being certain artifacts and certain issues which are very essential to we because I see it as though some of these pictures and some of these personalities that we have seen and that we have introduced about to inspire some of us to taking up certain career choices. I believe that there are some of the students who are here with certain strange thoughts about how medicine looks like, but with such an exposure, we're doing how certain conditions like growing heart, some strange things like brain syndrome and things like that, who are now inspired to taking such decisions to go into medicine.
I wanted to specialize in nutrition, but I want to be nutrition, but right now I think I want to be
You wanted to be what?
nutrition.
Nutrition, okay.
Right now I think I want to be surgeon. Right now, lots of things. I still haven't seen the nutrition. What I've seen so far, the organs, I think this is really good.
All these medications and infusions have therapeutic windows. So that if you give an overdose and overdose, it may cause problems. So in order to deliver the fluids at the prescribed rate, the infusion pumps will help to deliver. So that if you want to give 1 liter of normal saline over an hour, we'll calculate it, it will do exactly that. Instead of just gauge, should I give that? This machine will handle that. So it's very, very, very useful. Here is a very old ultrasound machine. When we say ultrasound, they are sound that are greater than 20 kilohertz, which is beyond the hearing of the human ear. The human ear can hear sound between 20 to 20 kilohertz. Beyond that, cannot hear, and that high frequency sounds are used to generate some impulses from the reflected rays of the echo. That's so just like how when you go to the marine world, you can use sound waves to check the depth of the sea and study certain structures in the ocean. For medical ultrasound,
what is the importance of history? To know that the past, we want to remember. You'll be seeing pictures telling our story from when we started to the 20 years. You also be seeing things about how medicine started. Okay? We know physicians and nurses. The surgeons are the ones who will cut. The physicians, the disease and look at it the right person. This is it.
This is also the neem tree. It's a very common plant that is sometimes used for medicinal purposes.
These are all the people you see here belong to the Gold Coast branch. So these are very, very important for the all doctors. Okay? And it is good in a museum to have such people, and then what we are doing is remember them, isn't it? So that I'm saying it's good to have a museum to help us remember history, to remember the past, and to honor those who have played a role in wherever we are. Okay, so we move from here, it's around Switchback Road to this edifice that you can see, right? Good. So we come in here to another one of our general segments. This is 2005. This is 2004 and this is 2005. Okay? This is a bit from 2006 or 2005. You can see our celebration where we all the fellows and we have it in December. It's a very big kind of festival. It's 1 week.
Your liver helps to detoxify some of the content. This is the breast of the woman who had breast cancer. This was someone's heart, which is a lung. So we call that cardiomegaly. Cardio is the heart of the lung. This one is the uterus of the woman who has had a tumor inside it, what we probably all find. This is the heart of someone who has a hole in the heart. When our heart is developing inside when we are in our mother's womb, there are certain holes in our heart, but they close by the time we are giving birth to. Sometimes these holes do not close, and they form some defects in the heart. So you hear hole in heart, hole in heart. It's not normal that after giving birth to your heart. This is one of the cases. Even for whether a male or female, you have kidneys. But for males, some of the organs that only males have is called the prostate. The prostate is behind your urinary bladder. The prostate is only found in males. Sometimes you can get problems like enlargement or cancers. In this prostate, it is abnormally enlarged.
20. What was that topic? A decade of medical postgraduate specialist training. Okay, so this was when we were 10 years old, and this is what our theme was. Okay, so we also celebrated during the 10th year. We were celebrating during the 20th year. All right, and this picture here, this is our president, Professor Dr. George. And then this is Sheraiti. She used to be Minister of Health then. Vice President, received the coin in Sahara. Okay, good. So let's move on. So 2015, let's come on.
Mental health in Ghana. New approaches to an old problem.
Okay, what is mental health? Yes, everybody should do that. That is mental health. At that time, you know what we do is that every year we look at the issues that are problems, okay? And then we look at our topic. So this is, as a mental health, and she's doing this. So she knows what we're talking about. Can we read that?
Financing healthcare in Ghana. The future of the national health insurance.
And you can see our dignity. Who knows this lady? Okay, it was Georgina. Somebody was saying Georgina. Oh, you are being smart. You are reading here. She was our Chief Justice. There was a Chief Justice of Ghana then, and she was our guest of honor. Okay.
Our eyes can't appreciate. Like if I look into my mouth, I'll see that I can't see anything. I will go and wash my hands before I eat. But as I'm small terms, you cannot see. So when you look at these under the microscope, you can find them. The nurse, when doctors or scientists are working, sometimes when they are studying the blood, there are smaller components. If you look at that, you just see a red sac, a very, very smaller component that we use the microscope to do. So it's very, very important in the work of certain group of doctors. And teeth problem, this is an ultrasound machine. It uses sound waves to look inside our body.
And this was when COVID entered into our country. Okay, so you see our fair, this is our festival, everybody had a mask. And unfortunately, we lost our
your hands to the side. You are having a sound there. These bones help us to walk, to dance, to talk. Without bones, you can't move.
So you can see that this is a lot of our presidents.
That's one. Just say what you think, that no answer is wrong. When you take your blood has some water in it, it has some red.
So I'll leave you to go around. One. So can I have two people?
continuous professional development.
Like you were saying, the purpose is to sharpen heart. In certain instances, for whatever the shares this representative sharing. And electro electro
What have you learned? People are referring me. Yes. Okay, madam, you raise your hand. Yes.
I learned that Dr. Suga was the first who have learned that she learned how to become more than say it's not the head, so the peak.
And we are hoping that anytime we call on you, your superiors will allow you to come so that you come and learn and get more inspired. So you can go around, yes.
Yeah. But another stage will come when we actually have to acknowledge you. Nephew was mentioning my name from the top there. Uncle T, I want to come to you.
Well, you said it's in the whole country. You know, so there are specialties that integrate the setup, the service,
Let's see, between the atria, you have an atria septal defect. The septal means a division septum, so they're divided. So atria septal defect or ventricular septal defect. This patient had a very big left prostate. Next to it is a cross section of the brain. So inside it is the white matter and the gray matter.
Those who have passed their exams to be members, we induct them. So we will say graduation, but the term we use here is induction. So this picture is depicting those who have been inducted with some honorary fellows and then invited guests.
So in the year 2007, the theme was championing African excellence in health. You can see the pictures. So these are some of the fellows at the opening ceremony. Let's move on. So these are all the pictures talking about what happened in 2007.
So it is between the atria, I would say an atria septal defect, between the ventricles, ventricular septal defect, and a sample.
It's good to achieve somebody. You have to use it. Somebody, I just read the book. It said the brain is elastic. You can stretch it. That's why you want to do the brain. And it all started like this. I understand it's still alive. It's a very narrow. Unless you mention the site, you never know the that is the picture. So during that, the discussion was not comfortable with lifestyle. And all these discussions are put into policy.
Sometimes the abnormal electrical discharges, and that can cause seizures. If you want to tell what is causing the seizures or which kind of seizure, we use the electro. Have we done the different kinds of waves?
Yes.
Yes. So sound wave, is there a mechanical wave or an electromagnetic wave?
Electromagnetic.
This is the dentist chair. It's pretty much, but it's still similar to what's being used currently. Okay, so yeah. Any questions?
that will address our needs as Ghanaians. So in the year 2000, discussions started on establishing the training or the college. And in 2003, that is when the college was erected or was built.
A defibrillator and like a monitor, a heart monitor. So it's a heart monitor. It helps us monitor the heart's impulse as well. So the heart also has currents. So we usually put some cords on it to help see if you have enough currents passing through the heart. You even see it in movies, right, where they apply this to the person and then they just shock the heart. So you see it in movies. So this is an example of what you see. So these are for people that have died that have disease conditions. Alright? And this is what happens when you have a pneumonia. Your heart, your lungs, this is a lung. Okay, this is the right lung. Okay. So the lung becomes, the part of the lung that is affected becomes solid when you have a pneumonia. So there's no air going into that part of the lung. But when you get better, it resolves.
In 2015, what was our team? The training, for instance, in the United Kingdom, we're not coming back. So if you needed, you know who a pediatrician is. I'm sure all of you have seen a pediatrician before. And the main aim or the main mandate of the college is what? Provision of what? Specialist education. Exactly. So it provides specialist education. So when the college was established, we were in a smaller building, but this particular building was completed in 2007. And that means some people graduate and we plan for the year, and so we call it an annual general meeting. So every year there's an annual general meeting, and we always choose a theme. So whenever you are doing something, you need to choose a theme, and the theme is based on the discussions or the topics that are being discussed in that year. So in 2004, the theme was what? Postgraduate medical education in Ghana, the future.
Then in 2020, COVID came. Moving access to healthcare system, the new normal. What is the new normal? What became the new normal? You are still in the, some of you are still in the new normal. Wearing of the nose mask, sanitizers, the new normal for us. You understand? This picture is solid. I told you to look at the picture before the giant global COVID-19. With this AGSM, it is outside. And then putting that waste. And then because of social distancing, that's outside. Then 2021 impact of COVID-19 on healthcare and medical training. This one is a picture of some fellows and members wearing, still COVID was around, but at least they were vaccinated and all those things, so we sit at the auditorium. Okay. And then in the picture here, we have some fellows, some members, and the governing council of the college. Okay. This one is now the rector of the